So yeah, next we have Neil from Dartford and Gravesham, so the CIO from Dartford and Gravesham, is just going to talk about the work that they're doing over there currently. So yeah, I think he's here. I did check a minute ago. Neil, can you hear
Hi,
us?
Sarah. Yep,
Oh,
I'm here. If
are.
you can hear it, see us.
We got you. Thank you. Perfect.
Excellent. I think I'm going to take a leaf from Catherine as well, and probably turn my video off as well, because you don't want to see the cats jumping up on the table while I'm at home and things like that. And my internet's also going up and down, which is classic for me. Whenever I do these sort of things, range from 200 megabits to 0 at times. So I'll turn that camera off. No one wants to see my face. Okay, thank you. Yes, I'm going to talk through Dartford and Gravesham NHS Trust's experience of PKB. We also implemented over the pandemic, or through the pandemic, but we had planned to do so before the pandemic. But yeah, if you take the next slide, I'll give a quick overview and an intro and things. So that's me. That's me at Mammoth Mountain. Actually, it's my LinkedIn profile, or it was my LinkedIn profile until yesterday. So my favourite place to go is Mammoth Mountain snowboarding. So I'm the Director of Digital Transformation for Dartford and Gravesham NHS Trust. Been working in the NHS for about 24 years now. Always in IT, finance, then IT, but EPRs, implementations, strategies. I'm responsible for the Trust digital strategy, our ICT department, clinical systems development that implements all the new systems, our clinical systems support team that looks after all the systems once they're in, and moving us forward with our acute health records and moving to digital. Next slide, please, Sarah. Sorry. So Dartford and Gravesham, if anyone's seen me present before, we're a normal hospital. We're not a global digital exemplar. We're not a teaching hospital. We're just a barn door normal hospital. We've got 550 beds across 2 main sites. We do span Kent and London. So our main hospital is in Kent, down by the Blue Water shopping centre in the Dartford Tunnel. And then we've got a second centre for elective care, which is in Queen Mary's, part of South London. The thing that makes us a little bit different is we set a strategy to be early adopters of innovative technologies. So we've implemented things like artificial intelligence and health wearables, health sensor wearables. And yeah, we have an ambition to be a self-made digital exemplar, as no one seems to be throwing money at us, although money has been coming out quite a bit recently, hasn't it? Next slide, please, Sarah. Thank you. So our PHR vision, our personal health record vision, is to provide a single patient health record across all of our services, and it to be that one central front door for our patients to electronically interact with our services. We want to be able to provide patients with all of their healthcare data electronically, for anyone that wants to interact with us electronically. And we want patients to be able to tell their story, as it says on screen, wherever they go, and take their record with them across care settings, across care boundaries, across both organisational, ICP, ICS boundaries, as we span both Kent and London, and we get a lot of patients coming across the water from Essex as well. And obviously, from the stories that Mo was telling earlier about empowering patients to manage their own healthcare conditions, we have a lot of complex patients with long-term conditions. We just want them to be able to better interact with their record in the hospital. And yeah, moving forward digitally and providing that good digital experience. So I'll talk through a little bit of what we've actually done and how we're doing it as well, I think. Sarah, can you? Thank you. So I was going to put together a bit of a technical infrastructure, but actually I think it was too complicated. So this is a simplified diagram of what we're trying to achieve across all of our digital strategy. So we're a best of breed site. We don't have one big single EPR. We pull together what we see of the best systems. We try and get the best out of our long-standing legacy systems. And this slide here really shows it as a functional blueprint of all the different components that make up an electronic patient record, whether it's a mega suite or whether it's a best of breed strategy. And the cheese slice to the left there is our patientsknowbest patient portal, and it cuts through all of the services. And our intention is to be able to show and allow the patient to interact with absolutely everything. That's our ambition. And then to the right-hand side, we've got our services with our other care providers in our integrated care partners and system as well. Sarah, next slide, please. So our approach, we selected patientsknowbest prior to the pandemic as part of our outpatients transformation program. I think we awarded contracting around February 2020, just before things really kicked off. And then through the pandemic, or at the start of the pandemic, we prioritised the deployment and said, let's just crack on with this and get it done. We spoke to NHS England, and they were asking us for ways that we could share the records with the Nightingale hospitals in particular. So if we had patients come into our ITU, we knew that we were a small hospital with only 14 ITU beds, I think it was. We were expecting to have to transfer patients quite a bit, and then not necessarily be able to receive the patients back into our own hospital, so they might have to go elsewhere. No one really knew what was going to happen back then, did they? So we reprioritised. We pulled a very small team together, just crack on and get access to the patient record as fast as possible. I think we gave ourselves a 3-month ambition to have it up and running. And we took a little bit longer, and I'll talk through that in a bit. But we actually achieved it at real speed and scale, and we've got a very large number of our patients actually on our patient portal, interacting with some of the most basic services, and a plan to move on to much more. So at the moment, we've integrated our PAS system. All of our inpatients, outpatients, and A&E interactions go through to Patients Knows Best. We got our appointment letters sending into Patients Knows Best, so our patients would be informed of their appointments very quickly, and changes to their appointments as well. If they had to cancel them, move them to virtual outpatients instead of in-person appointments. And we also sent out mass invites of all of our active patients. We targeted every patient across the hospital except for our paediatrics, and went for any patients that had been a patient of our hospital, inpatients, outpatients, or A&E in the past 2 years, or any patients we had a plan to be seen in the next 6 months. And they'll received a letter with our invites that way. We had a very rapid uptake of the system as well. And then we've got plans, and we've not gone live this yet, we've built out a plan to send in the electronic discharge notifications, our A&E outcomes, and our outpatient letters as well into PKB, and that's about to go live in the hopefully next month or so. And then next, we've got diagnostic results. We had planned to do this right up front, but we have hit some barriers internally with politics concerns, which PKB are helping us to work through. And we've attended some great talks on that recently. I'm sure others have as well. Where we plan to do specialty-specific interactive services, so maternity, diabetes, respiratory services, and start building out those. And it's quite interesting to see the renal services as well that people have done. And then we've got preoperative, very interactive services with other parts of our system. So preoperative assessment, we're looking at how we can work with our inpatient e-noting solution to start that preoperative assessment process, and then have patients complete their questionnaires and their consent, and then have all that data come back and allow us to triage and flow the right patients to make sure we get the right patients into theatre at the right time, or reuse and reallocate slots where patients aren't quite well to be brought in for their operations. Next slide, please, Sarah. So how do we do it? What do we do? And what were the challenges? So we procured in February 2020, and we actually commenced the project in May. I had to go back and check this, and that's the first sort of proper interaction we had with PKB after signing all contracts and doing the IG and reviews and things. And we spent a while on the IG parts. I'm sure the PKB team will remember. And we actually went live with it in November 2020. So we did miss the first wave, but we were ready for the second wave, which was good. What worked really well for us was the supplier relationship. Patients Knows Best team put up with us. They put up with all the questions we had, and the questions on IG and who owns the record, who's the processor, and other parts. We have a very rigid cybersecurity process as well, reviewing how everything works, and PKB's team took us through the absolute in-depth ins and outs of how everything is secured all the way through the different components of the record. And it's a very complex solution and very modern as well, but we were absolutely assured on the security arrangements on it. So the other stuff that's gone really well, the supplier documentation, so PKB's documentation, being completely open and on the internet for anyone to dip into. You don't have to be a customer to look at it and see how it works. The HL7 specifications and the APIs and things all out there, that really helped us to, even before we'd started the project, get our own teams and our external people that look after our interface things were able to get up to speed very quickly and speed things along, so we didn't have lengthy conversations around technical specifications, things afterwards, after we'd sort of signed the contract. Testing and interface turnaround, all of that worked very, very quickly to get us up to speed with getting our interfaces out for our PAS system and our letters. We've got a very clunky old PAS, and letters don't work as nicely as you'd expect them to. So we had to have a lot of integration work put in place to be able to get our letters out of our PAS, looking nice, sent across to patientsknowbest in a decent format, with all the patient information leaflets and things that go with it as well. And then the process for inviting our patients and mass inviting our patients, it was laid out for us really simply. All the comms and the letters, example letters and things was all pretty much done for us. We just had to tweak a few words and just get sign-offs and things. That was all worked really well. Some of the challenges we've had, and I'll come back to NHS app integration in a minute, but some of the challenges we did have was obviously deploying through COVID. Our resources were completely stretched with hundreds of different projects, getting people to work from home, getting our ITU to work with virtual board rounds, getting outpatients to move on to virtual and things. There were a lot of pulls on IT's time and clinical time to be able to go through and get everything working. But we did manage to cut through it. Trust resources, we had a very small team to do this, but actually that was a pro and a con. On what worked well, we had a small nimble team and we did just crack on and get stuff done. It worked very flexibly and very quickly. On the downside of it, I think our next stages have been hampered a little bit because we've not got the resource to really focus on that specialty by specialty transformation. But we'll be coming back to that and hopefully cracking on with that quite a bit. We've got big plans for working with PKB. The cultural change, I think we've gone slower on things like results for pathology and radiology, and also using the interactive messaging services than we had ambition for at the start. But I think now that people are starting to see the benefits of PKB and patients are starting to interact and ask and push us along, I think we're going to see that really change through this year now as well. The other challenge we had is because we did this at speed and we went for a bigger cohort of patients than we initially would have wanted to. I think when we set out the business case for this, before anyone even thought of pandemics, then we had planned for quite a slow trickle feed and service by service take up of the patient portal, and where we moved to a rapid, let's invite as many people as we can and get them onto the record so that if they end up into a hospital and end up contracting COVID or coming to a hospital because they've got COVID and we have to send them out to one of the London Nightingales and they may not come back, let's send them and we'll scan in their record and we'll publish things and we'll get them out as quickly as possible. So that changed from an idea of having a few patients registering per week, and we had an ambition in our business case to end year one with 10% of our patients signed up, I think it was, of our active patients that come in there and then. And we moved to a mass registration where we're inviting, I think, 1,500 patients a day. I think we was doing over 2 weeks. So we weren't set up for that. And one of our team basically took on the task of managing all the patient contacts. And we didn't stop and give too much thought around the age ranges that we would invite. And we had patients that were 95 years old contacting us and saying they wanted to use the system. Could they just have a bit of help on getting onto the system? And what's the difference between patientsknowbest and their GP record and other bits? And we managed not only phone calls, emails and things, but we actually had lovely handwritten letters from some of our patients accepting, yes, we want to do it. Could someone please pop round and help us to log on and things? Which we responded to, and we sent our team round, obviously, to get them on.
Neil,
but yes, we just weren't set up.
Sorry to interrupt you. Can I just give you a low? Oh, you're a bit beyond your 5-minute warning, but yeah, a few minute warning.
Okay, right, no worries. Okay, the NHS app integration we've turned on in August 21, and that's been a massive, massive success for us. We now see naturally 750 patients per week, I think it is on average, signing up without us inviting them, and so just patients have had ours. So there's an important slide, so I'll move on though. Thanks, Sarah. So some of the stats, which kind of speak for themselves. The first graph on the left is our NHS app integration registration, which shows us hitting around over 750 some weeks of registrations. On the right-hand side top, that's our total number of patients that have registered. So we've got, I think when this was took a couple of weeks ago, we were at 29,000 patients registered, and this is, we've now got every patient in our PAS that's ever come in is registered. So it looks around 11%, but actually in reality, it's way higher than that, because we've invited so many patients we've not seen in the past 2 years and things. So we think it's around at least 25%. And then the slide at the bottom, or the graph at the bottom, shows the interaction, which is just growing and growing and growing with the record. So 4,000 or 5,000 interactions, things at any one time, which is great. Sarah, I'll move on. Thank you. We'll take questions, I'm sure. So the big stuff, what's next? We're going to get the remaining documents into PKB, the EDNs, the outpatient letters, the A&E outcome letters, pathology and radiology governance we're working on at the moment to be able to release those results to our patients. They can start to manage their record. We want to enhance our comms with our patients and our clinicians. Obviously, the questionnaires and things going out to patients for specific conditions, pre-operative assessments I spoke about, and we've started focusing now on maternity. We're opening up the system to maternity rather than have a separate maternity patient record. It's all going to be within PKB. We're working with diabetes with our e-noting solution and PKB to really optimize how we can work with our diabetes patients, and the pre-operative assessment again there. The big thing we've got an ambition to do is to really develop a really rich suite of interactive services and move to remote care and remote diagnosis of key conditions. We've been working on that quite a bit, and I think that'll be the last slide that I move on to. Just a quick overview of what our ambition is. So we plan to work with a lot of innovative suppliers. PKB have got a huge body of suppliers they already work with, and modalities and medical devices that can integrate with it. We look to harness that and have our patients being looked after at home as long as they possibly can, avoiding the need to come into outpatients, hopefully avoiding and keeping them out of A&E, and have all that data come through into patientsknowbest. And then working with Alcidian, one of our key partners, we're building a remote dashboard so that our clinicians can log on in the morning, see the patients that are remote, that need care, attention, and interaction with, but also on the other end of the scale, patients that perhaps haven't interacted with their online record or haven't taken their observations, haven't submitted their observations, so they can go back to them and say, actually, we need to call you in for your appointment, and start to use that way of working along with the PIFU methodology to make sure all our patients are kept as healthy as possible. And I think I'm done. Thank you, Sarah.
Thank you. Sorry to rush you.
That's right. I always need a prompt.
Thank you. We do have a number of questions for you. So the first question was, do you have an existing pre-op solution, and can you expand on the intention scope with that?
So the pre-op solution is going to be PKB, effectively. So we will kick off the request for pre-operative assessment to be completed by the patient from within our e-noting solution, and that will fire a request into PKB. That then triggers the patient questionnaire to be completed at home before they come in, and we then will be pulling that data out of PKB daily to find all the response to those questions, work out which patients are fit and well to come in and which ones shouldn't be coming in and aren't appropriate to pull forward, and then we'll be able to reallocate those theatre slots or pre-operative assessment slots. So yeah, it's very much around our e-noting solution and PKB partnering on that one.
Thank you. Next question was, you mentioned you had invited inpatients, outpatients, A&E, and those patients that had appointments in the next 6 months. Did you invite all patients that have ever been through your PAS system, or did you go back for a certain amount of years, or just patients that had activity?
So we went back patients that had activity for the past 2 years, inpatients, outpatients, and A&E, and then any patients that we were due to see in the next 6 months.
Yeah. There was a follow-up question to that, sorry, from the same person, which saying, you mentioned that we invited 1,500 a day for that period of 2 weeks. And do you, this is going to test you, do you know how many signed up? How many signed up in that period from the invites?
Oh, crikey, one of my team would know. So we invited, now I'm doing this off the top of my head actually, so we invited 200,000 patients, I think, off the top of my head. and it did go on for longer than 2 weeks. Did 2 weeks, then we stopped because we couldn't cope with the uptake, and then we went another month, and then I think we invited the rest. So I think we did like 20,000 batches originally, and then a little break just to let Sandra, who's managing it all the uptake, we allowed her to have a couple of days off over Christmas and things, and let things go a bit quiet, and then pick up again in the new year. So I think we saw around 300 patients per day taking up the invites, and we were sending about 1,500 to 2,000, depending on how we were feeling on the day.
Yeah. Thank you. And it's similar, I guess, in similar vein. The next question is, what is your internal support team like? How many staff do you have to support the BAU running?
So the BAU have now moved from IT, which we're quite pleased, and the one single person we've got. But that one single person was actually heading up our health records department at the time, a member of my team that had gone over to look after health records. And we've set up our health records team and our subject access request team to manage queries going forward. There's things like obviously checking patients' ID, are they who they really say they are, and things. Did we send the invite to the right person? And I've forgotten the term, but where you can look after someone else's care and thing, you've got power of attorney type thing over their health part rather than the financial part. They'll do all of them checks, and if there are any technical questions they can't deal with, they then forward that on to our IT support team, or we put on PKB.
Thank you, Neil. I think we'll leave it there. There's a few more questions, so I'll share them with Neil afterwards, and the team at Dartford. I think probably the whole team to answer those, and we'll follow up. But thank you, really, really appreciate you speaking today.
All right, thank you.